Welcome to Living Fuel TV. I'm KC Craichy. What is the #1 cause of death in the United States? Well, we're here to find out right now. Welcome, Dr. Purdue. Special guest. We're excited to have you.
Thank you.
This has been a fun series.
Yes, I've enjoyed it very much.
We're going to talk today about the conventional medicine. So conventional wisdom says that it's cancer, heart disease, diabetes, and so on are #1 causes of death. But what is the #1 cause of death in the United States?
According to an interesting white paper a number of years ago, medicine, conventional medicine.
Conventional medicine. So between drug mistakes, drug interactions from properly prescribed drugs, staph and other kind of infections picked up in the hospital environment, and medical mistakes from surgical perspective, these were the cause of how many deaths in the United States?
Roughly around 800,000 deaths per year.
800,000?
On average. And that was taking the low end of the ranges from the studies that were called for the report.
Okay, so what is the most dangerous place again?
Hospitals.
Hospitals.
Right.
So what's happening right now as far as infections in hospitals?
Well, everybody by this point in time has heard of MRSA. MRSA basically is a man-made bacteria. It is a very aggressive, mutated form of Staphylococcus that basically was caused by the overuse of antibiotics. Because what happens is, most people know, you prescribe an antibiotic for whatever bacterium. Most of the bacteria are killed off, but not all of them. And those ones that survive can often develop survival strategies, and they mutate and develop a strategy against that type of antibiotic. That's why we have to develop increasingly stronger types of antibiotics to deal with common infections.
So right now, how did that happen? Started out with penicillin was a cool thing. What did we do before that, and how did it change subsequent to penicillin?
In my opinion, from what I've gathered from reading the literature over so many years, there was 2 vectors that contributed to antibiotic-resistant bacteria. One being the vast amount of antibiotics delivered to livestock. Roughly 80% of all antibiotics used in the United States currently is in livestock. So we eat conventionally raised beef, hogs, etc., and you're getting some of that antibiotic that way. Plus the cattle's bodily excretions will end up in the groundwater, and we end up with antibiotics contaminating groundwater and so forth. The other vector is, for so many years, physicians would prescribe penicillin and erythromycin for viruses. So little Junior or little Missy would go into the pediatrician with an ear infection. Let's give them an antibiotic right now. Even though data accumulated over the years clearly demonstrated that over 2/3 of all ear infections are either viral or allergic, not bacterial.
Well, there's also research that says that if you give antibiotics, it will take approximately 2 weeks to recover from the ear infection, and if you don't do it, it'll only take 14 days.
And often even sooner than that. A very good study that was in the Journal of Otolaryngology about, I don't know, maybe 15 years ago now, demonstrated that if you have a viral or allergic ear infection, which is, again, over 2/3 of them, and you just leave them alone, that most kids will recover within 48 to 72 hours with no pain after that. You dump an antibiotic into them, well, you've just changed a whole lot of environment there, and you've actually suppressed immune response, so it's going to take longer to recover.
I know that we've gone to singling out antibiotics in this mass area of people getting injured or killed from conventional medicine, but I think it's important because people think that is just a normal course. They go and have an upper respiratory tract infection. Again, what percentage of those are viral?
Well over 50%. In fact, closer to 2/3, just like with ear infections.
I've seen the same research, but what is the standard of care?
Normally an antibiotic is given right away.
Right away. So what does that do to a patient that has a viral infection that gets an antibiotic?
Well, I can tell you from the experience I had with my youngest daughter, this is before I went back to school to study medicine, who was in that boat. And what happened was she got an antibiotic for an ear infection that actually ended up being, we found out later, an allergic reaction to dairy.
Which it generally is, by the way.
Which often is. And so she got into this pattern of having to be on an antibiotic virtually all the time. And her zest for life went downhill. Her ability to resist other infections went downhill. She was a miserable kid.
Well, no one has a penicillin deficiency.
Correct.
So, or any of these other drug deficiencies. So So the drug should be really the last thing that you try.
That's my philosophy.
Because right now the superbug is a real deal. Medicine doesn't talk about it a lot, conventional medicine or otherwise, doesn't talk about it a lot because they don't want to scare the public. But there really is very few options left for some of these hospital-derived staph infections that you're discussing.
Exactly true.
Which are?
Well, MRSA is the big one still, but there are other emerging superbugs. And right now they refer to them as vancomycin-resistant bacterium. Vancomycin is about as strong as it gets. So when you blow through that, the way they're treating it now is by creating cocktails of several antibiotics. So
what's an alternative for a staph infection?
Actually, believe it or not, garlic. There's a compound found in garlic called allicin. Studies published in British Medical Journal, British Journal of Medicine, showed that a concentrated aqueous extract of allicin was enormously effective against MRSA and other similar bacteria.
And oregano extract also.
I use it all the time for upper respiratory infections very successfully. And there's, even with the viral pneumonia, both bacterial and viral pneumonia, there's a classic old Chinese herbal formula that I use with my patients, and it'll knock it out of the way in about 5 days.
Again, I'll remind the audience that Dr. Purdue is a doctor of Oriental Medicine, a naturopathic physician, and approaches these things from a non-allopathic way. But again, these drugs cause so much serious side effects, and the risk of overusing for ear infection. If your kid has an ear infection that's a repetitive ear infection, almost assuredly there's a problem with dairy, grains, sugar, something along those lines. There's a lot of good information on the web out there now about that. But continually going to antibiotics, if you get this, keep doing the same thing, and you're going to keep getting the same result. And if it's not changing, you need to find some other answer. And additionally, while taking antibiotics, they really need to be taking significant amounts of probiotics at the same time.
Exactly, yes.
And that is not typically done.
Rarely in the conventional setting.
Interesting. So again, what else in medicine? Like avoid going to the hospital. I mean, anytime you can, for sure.
Right.
But I mean, sometimes you can't avoid going to the hospital. So what do people do to protect themselves? Because so many people go in with one problem, and they end up really dying or something from pneumonia or staph or something along those lines. So,
well, as a very famous MD said in a class I was sitting in one time, he said, "Heaven forbid you're in an accident and you have to go to the ER, but if you do, get out there as quickly as you can." That's the advice.
That's good advice.
Yes, he was actually a physician on Air Force too at the time. So,
so we pray that you don't have to go to the hospital. I just wanted to point this out to you to have you really think, and again, take your own health care into your own hands and do your own research, because going into the conventional system oftentimes yields conventional results, and it is not without danger. So we hope it helped you today. God bless you, and have a great day.